Today we have Dr. Rama Krishna Chaitanya, sir. We know him very well from our Marrow anesthesiology classes. Today we will get to know about the branch, and he has extensive experience of 13 years. He practices in Hyderabad area. And sir, can you describe the anesthesiology as a branch and what the work we do in this branch?
Hi, Dr. Derek. Thank you for inviting me and for this session where I am here to answer some of the queries of the students. So, yes, it's a good question. Those who are about to take anesthesia as their career, or many students are confused at an undergraduation level because really no one gets to expose to these branches. Like we call it as short subjects in during our preparation for the PG entrance time, but the skin, anesthesia, radiology, they don't have really curriculum at your undergraduation level. So many students are confused about this branch, how it is looking, or they might have some idea which they get acquired in during their internship, or when they are about to take the postgraduate entrance examination, or after they cracking this seat, when they are about to get this probability of getting these branches of anesthesia. So they might ask some of the seniors who have just passed out 1 year, 2 year, 3 years, or they might ask the PGs who are working in the department. So very often, because you can't directly, in a medical college we have this hierarchy where you can't directly ask a professor of the department that how is this prospectus. But I really appreciate Dr. To bringing out this one, because I don't consider myself as a senior most anesthesiologist, but yes, I'm working in the department since 13 years in various varieties of branches. Like I started working from a government hospital, again in a teaching hospital, corporate sector, in a government organizations and non-teaching organizations, various sectors. Like I traveled through this journey of 13 years with transplant anesthesia, cardiac anesthesia, ICUs, and right now I do majority of my cases are pediatric anesthesiologists. So I have seen various spectrums. I don't say I am an expert, but I have some amount of slightly more information, right? I don't say knowledge, I say it's information, apart from those who have justly passed out or those who are this post-graduation. So we all know anesthesia as a specialty. If you ask me, it's a wonderful specialty, because from me, those who are opting to take anesthesia specialty, so when the student is preparing for the entrance examination, they don't keep anesthesia as their primary target and enter into this specialty, right? So they have so many things that are built up. So basically, anesthetist is a job which is there in the OT. Actually, yes, we are spread across the hospital, starting from ICUs, emergency medicine departments, pain clinics, pre-anesthesia clinics. So the spectrum of the branch has been increasing widely. So it's a wonderful branch. The students who want.
You said that there are many pros and cons about the anesthesiology. So can you describe them in detail, that what can someone expect from anesthesiology as a branch, and what are the cons?
Anesthesia, you can expand financially. Yes, definitely you will get a job very quickly. Second thing is, if you want to read and subspecialize this anesthesia, it is a very good branch to subspecialize yourself, like cardiac anesthesia, neuro anesthesia, or you can subspecialize into pediatric anesthesia, organ transplant. And many of the students, they take up ICU as their career. Okay, so pros is financially, it will satisfy your needs immediately. When you compare to a surgeon, I actually, this comparison really comes out, because surgeon needs to have some amount of, he has to develop some amount of expertise. Third reason is you will have the satisfaction. When you come to anesthesia as specialty, you are trained to manage the emergencies. You are trained to manage or catch hold of the things when the things are going wrong. And you will be one of the strongest person in the operation theater who can it's like, my professor used to say this word: surgeon is the captain of the ship. Definitely everyone agrees it. Surgeons is the captains of the ship. But anesthetist is the captain of a sinking ship. When the things are going wrong, then comes the picture of anesthetist. So when he comes and it is at his expertise level, he can now catch hold of that ship, and this gives you immense amounts of satisfaction of what you have read all these years.
Right.
You will be having immense amount of clinical satisfaction. So professional satisfaction is there, financial satisfaction is there, then comes clinical, personal satisfaction is there. So these three are fundamental things which a student should actually consider it. So these, I feel these three are very good positive points about it. Coming to the cons of the department, yes, as I said, you, no branch is not you show me any branch, I will show the con for you. So it's not about con, but some people are not that much, when you ask me, sir, when you compare to surgeons, yes, I said financially we might be having very quick earnings in the financial journey. But what happens is when you start up the journey, your financial plateau will reach soon. In my city, the maximum amount that will be paid for a liver transplant anesthetist is around 2.5 to 3 lakhs, right? So maximum 3 to 3.5, some people say it, but let us keep it like a round figure. So 3 lakhs right now he is earning after doing liver transplantation and doing his fellowship. Not directly, like, the moment you passed out, I'll be taken into. So you will be attaining. But at the same time, when you compare with a surgeon, because you can't compare. Actually, many students ask me, sir, what is the amount? Yes, surgeon takes a lot of pain to mobilize this case, do the surgery. He might be trained in handling, his way of training is very different when compared to me. So financial plateau for him might be attaining at a very late stage. But when you see my graph, it will be starting at a very early stage. So at the end of the graph, if you see, more or less, we will be at the same place. Like slightly, he might be on a more side, but how much amount of energy he has spent, how much amount of energy I am spending. If you see an orthopedic surgeon, getting a case into the operation theater is not an easy job, and post-operatively he will be following up. But for me, I'll be handling only that part during the operation and immediate post-operative period. I'll not deal with the complications of post-operative, non-union, malunion, etc. So he has to spend. So depending on the amount of energy what we are spending, everything will be equal. But if you look at on a, like, if you look at very superficially, you might feel that yes, we are getting a plateau, we are hitting the plateau very soon. Yes, and that is one of the biggest call of it. Second thing is, as I said, this branch is expanding from pediatric, cardiac, neuro, whatever the specialty you say, I am there. When I am saying this word, I am there for you, that means I am taking a lot of stress on me. Believe me, when I am taking care of neonate, it is a different kind of stress when I am taking care of a CABG patient, because both are different stresses, and I need to be thorough in both understanding the physiology and pharmacology, because at the same time, giving anesthesia remain for a normal person, it might be looking same, but understanding the physiology, understanding the pharmacology, doing the things, this will add up a lot of stress. And that too, many places anesthetist will jump and stretch into ICUs. Again, medicine knowledge I should be incorporating. So when I am catering various people, obviously my stress levels are increased. And how efficiently you will handle the stress, this is one important point. Right. So this is the second disadvantage what I found out. Third disadvantage is, you will never be recognized, because, I stay in a place, I tell to many of the students the same thing. People don't know what I do unless I don't do it. So by the time people realize your worth of it, sometimes it might take a lot of time. So some people are not happy with this, the way you are getting the name when compared to, the whole point comes when you start comparing with some other person. So when it comes to surgeon, many of the orthopedic surgeons, you get a joint pain, your ankle get twisted, you immediately call your orthopedic. The moment you enter into a society, living society, you will understand, okay, he's an orthopedic surgeon. So when I have this bone problem, I will go and meet him. But when it comes to anesthetist, yes, people don't know. I don't require anesthetist. And you will be requiring anesthetist when half of the things are going worse. Okay, so the third con, if you ask me, so the recognition from the patient's perspective or from your colleague's perspective, it all depends, or majority of the times you don't be recognized at all. So that's a con, I feel. So broadly, these are 3 pros and 3 cons of the specialty.
How can we differentiate that in the future? How will these two branches will overlap, or emergency work will be taken by emergency medicine physicians, or anesthesiologists will continue the emergency work?
Yeah, and emergency medicine, they are distant apart branches. Yes, we were handling casualties because I was in charge of the casualty when I was working in the corporate hospital in 2013. If I am not wrong, this emergency medicine came somewhere in central institutes between 2014-15 at that time. And now, right now, many colleges have this emergency medicine. But if you ask me, both are very different set of branches. This emergency medicine is a very beautiful branch when you compare, because they will not enter into the OT, but they will be handling the casualties. Again, out of these two, I will never judge a branch depending these two things, because there is nothing in the branch as far as me is concerned. Personally, after these 13 years or 14 years of my career, what I understood is uh, branch is there. Even if you are there, even if you are not there, the branch is there. The charisma of the branch is there. So you can't compare between medicine and surgery and say medicine is good. Some people like medicine, some people like surgery. So both are, you can't say this is good, this is bad. So in the same way, emergency medicine never be overlapping. They will never come into the OT and they start doing the work.
Can you describe the current, how is anesthesiology residency, and like what are the work hours, how it's hectic or
Yeah.
work-life balance in other aspects?
Yes. So my professor used to say this, when you are taking up the residencies, yes, put your wholehearted effort during the residency period. Whatever the learnings you have to do, you will have to do in the residency period. Whatever the mistakes you have to do, you have to do it in the residency period only. You can't afford to do a mistake once you get out into the practice. Right. So, and especially anesthesia like branches, you should never do any mistake, because that is life threatening for the patient and it might be suicidal for your career also. Right. So, when you take up the residency period, my sincere advice to the junior consultants or those who are aspirants of taking anesthesia, definitely think these 3 years as a period which you need to dedicate, especially the first year period. The first year period is very, very crucial, because you will be out of your medical college. Might be you might have taken a break of 1 year period and you entered into this. The department is new, the working culture is new, the people are new, the way they look at the things are new. You are not experienced with this. Till MBBS level, it was like, okay, during your internship also, you might have done hectic duties. But definitely, if you are working in a good medical college, anesthesia residency is one of the stressful residencies which we can consider, and that too more especially in the first year of the period. And second thing is, you can't, like, if you are having some problems like health issues, or if you are having some other issues, yes, this might be a big hindrance, or major hindrance for when you are doing the these long hectic hours. So working hours are definitely very high. Second thing is, yes, in residency period, the amount of techniques or skills what we have to learn is less when compared to a surgeon. It is less, because we are only, like, if you ask me, if you put it in a categorical wise, we give regional spinal anesthesia, we give general anesthesia, intubation, spinal anesthesia, some blocks. So technique wise, there is less techniques for us to master. But yes, we need to be patiently sitting beside the patient. Patiently sitting beside the patient, and you should be able to follow the trends of the patient. It's not about, you give anesthesia, get out of the operation theater, come in between and see the patient is fine, okay, fine, again you go out for a coffee. No, you should be able to sit with the patient, you should be able to monitor the patient, and 99-95% of the times your work will be nothing. Only 5% of the times you have something to do in your day-to-day routine life. Right. So if it is a boring day for me, it is a good day for me actually, because I am doing nothing. I am just giving anesthesia and sitting there having my cup of coffee or a cup of tea. Right. If I am working, means something is going wrong in the department. So whole period of training is to identify that which patients are going to crash or which patients are going to land up in a problem. And your expertise comes if you able to identify them in prior. That is what important. And if you want to identify them in prior, you should be patiently sitting with the patient and monitor the trends. That is what, there is a very popular statement in our department. We call it as, like, hours of boredom, right? And minutes of thrill or excitement. You will be having, seconds of excitement you will be there. So even you should be able to sit there And in the whole hospital, I read it somewhere, the best place should be your operation theater only. Then only you will become an anesthetist. If you are thinking half of the time, if you are thinking, I will go out, I will go for traveling, I will go for trekking. Okay, you can't be sitting at one place in the operation theater. So as a resident, if you are entering into that my department, I expect you, at least for the first year of the period, you commit yourself to the department. Not learn the techniques, because eventually you will learn the techniques, but learn how to sit with the patient. Because I myself, when I entered into the department, it was like very painful for me to sit with the patient and do nothing, just keep my hand on the pulse and look at the monitor, keep my hand on the pulse and look at the monitor. It took me almost like 6 months to be with the patient and monitor it. Now it has become routine for me. The moment I enter into the OT as a senior consultant also, what my hands do is directly go and keep it on the pulse and see what is happening. So I will be looking at the patients right now, like, when I am monitoring the patients, if I am giving sole anesthesia, I will never leave the patient, because now it has become a habit for me to sit with the patient and do. So working for long hours is first key point. Second key point is to able to sit with the patient. That is very, very important. Third thing is, like, if you are having some problem, like health related problems, where I don't say, if you are stressful person, if you are like a slightly anxious person, it's okay, because we do all have this phenomena. But like, suppose if you are having difficulty, suppose you are having, I'm taking a hypothetical example, if you are a known case of seizure disorder, if you are a known case of having polio, can't run. So preferably, I will say, yes, choose wisely when you are taking this department, because this needs to stretch out. You have to stretch yourself maximally. So at this time, I will ask the students to rethink or read. I don't say don't take it, because I have seen so many of the students, many of my colleagues, they have also got renal transplant and they are working comfortably. It's not about the disease, but how can you handle that amount of long lengthy hours, whether during residency or after during residency? That's a very important question which you need to answer for yourself.
Yes. That's which type of personality should choose anesthesia and should not choose anesthesia. So you just told that.
Yeah, I'll just add a word here. See, here, many students, they call me every year. They say, sir, I am an anxious person. The moment I see people, I will get tensed up. I will tell you 101 people. I have seen so many students. If you are a slightly anxious person, it's okay. If you are having some sort, this is all normal process of the development. I wanted, especially because many girls, they call me, they say, sir, I'm an anxious person, I don't want to take this. Yes, but this is a classic example which I every time quote, because this is how the branch has evolved. Yes, I have seen some people who are utterly shattered when they have an unexpected cardiac arrest. But not only you, even after 13-14 years, I will be shattered if a patient whom I don't expect any complication and he lands up in a complication. So it's not about the complication, but how are you handling this complication is what the training residency is. So the persons who can handle the stress, the person who wants to be like this, I say this is wonderful, man. Those people, like, people who don't want to work, some people want a cool job. Some people don't want to, they want to have some other passions. Anesthesia, because, you are getting anesthesia, you want to take it, but half of the time you think of some other thing. Yes. So these are the people might be, they will have, I don't say don't take this bad, you will have difficulty in adjusting in the residency period. And one more important advantage, what I can tell to these people, those people who are interested in research, those people who want to work with MNC companies in terms of medical devices, because most of the medical devices what you see in your ICUs, they are actually designed by a biomedical engineer, but anesthetists are the person, end users, whom we are using it on my day-to-day basis. So I used to work with some of the companies where we used to help in designing these syringe pumps, infusion. So you can really work with this if you are really passionate about the learning of the things. This is wonderful branch. If you are like slightly lazy kind of person, you want to push your work to some other people, you don't want to do night duties, not because of any other reason, just you hate night duties, you might be having difficulty. Those people with some physical ailments, diabetes is there, I don't generally recommend them. Juvenile diabetes is there, I say choose another option, because I want you to glow me, because though it's a good clinical branch, you can learn to handle your stresses, but might be initial period you might be facing the difficulty. So that's my answer. So it's an open branch for all, except for the people who don't want to do night duties. I don't want to work. I have so many other commitments. Yes, I do say, yes, think over, think twice, because that's the reason why, that's how the department goes.
That is that private practice available in anesthesia, or you have to do job and other things?
Okay, because in any corporate hospital, the whole goal is to, the whole amount of money the hospital earns is from two places. One is operation theater, the second one is ICU. So if these two are there, so obviously the people who are working in it, they are paid more, right? So that's one important point. So the second point is, when you, whether if you are handling this kind of patients, I have seen so many anesthetists, they are independently doing their, in an interior spaces, where they open up the hospital. This is one specialty which I personally feel, if you are an anesthetist, and you are working in tier 2 city, tier 3 city, you can comfortably open up any hospital. You can comfortably open up your small nursing home setup, whatever you are planning to open up in your place. You can, because you know how to handle your emergencies. And if you are trained well enough, if you are, inquisitive person, you want to learn new things, you will be learning with the surgeon. You will be standing with him. You will be diagnosing appendicitis. You will be diagnosing hollow viscous perforation. You will be diagnosing head injury, SDH, except everything you can learn during your residency period only. It's not like, you will be confined to one specialty. So when you learn a lot of things and you have some amount of experience, when you open up the hospital, you can sit comfortably in an OP practice area and start doing your own private practice. So you can see, it's not a big thing to treat. I don't say it's not a big thing, but it's easy for you to treat normal, URTIs, LRTIs, etc. You can look at the chest X-ray, you can see the ECG, you can come to a diagnosis. Very rarely, like, if you ask me, sir, can you make this complicated diagnosis of Georgian syndrome or something like that? Maybe, I might miss out pernicious anemia. Maybe I might not make out this, but common elements, definitely I can do. So one core area anesthetist can do is, you can do your own private practice. You can start up your own nursing home and do it in an interior place. You can hire up the surgeon. The moment you diagnose a patient with torsion testis, you call up a surgeon, and you can be doing these things very comfortably. I know some of the people are doing this one only. And coming to the when you are working in corporate sector, you will be handling various things. So you will be paid well. So obviously, when you are working in medical colleges, again, medical colleges, we have this hierarchy system: professor, associate professor, assistant professor. So depending on it, you will be paid well. So the amount of payment what you are getting, so that would be, proportionate. In medical colleges, I don't think there is any discrimination. Whether you are a surgeon or anesthetist, you will be paid equal, depending on your cadre. But corporate hospitals, yes, definitely, as you are getting more expertise handling ICUs, taking the in charge, you will be paid better thing, and you can actually do practice if you want to. After so many years of practice, if you think like, I don't want to do this practice and do my private practice. I have seen so many anesthetists doing the physician role, because we ourselves, we will diagnose so many diseases in pre-anesthesia check. Provided all this, provided if you are inquisitive.
Can you throw some more light about that? Like, what are the options after MD anesthesiology?
Yeah, after MD anesthesia, again, this is one of the very welcoming point to the students, those who want to go abroad. Anesthesia is one specialty which you will be called very quickly. Not only, UK, any European countries, the only problem is with language. Actually, you have to learn the language, then only you can go and settle there. UK is one good place where a lot of Indian anesthetists are working there. They are trained here, but you have to get their degrees in order to practice there. And getting their degrees, again, you need to qualify them, but it's not like they will not give you this branch. So once you are having one degree, then it will become easy for you to settle down as a consultant. It's not like a cakewalk, but yes, compared to surgeons, it's easy if you are going abroad. And second biggest advantage, what I feel is, suppose if you are a girl, female, you are in this city, and after marriage, if you are settling in some other city, I am from Hyderabad. Suppose imagine I am settling in Delhi. So immediately, if I move to Delhi, I will get a job there. It's not like I will not get the job. So because you don't have any clientele, right? So you go, you will develop your own clientele. So after MD, one good opportunity is wherever you go, you can get the job. And especially those who are planning to go abroad, I know many of my anesthetists, they have settled in UK, Australia, New Zealand as anesthetists after completing their residency over there, because Indian degrees, they are not that much valid in developed countries actually. Again, but when you take, if you want to go to Middle East countries, 3 years post MD you have to wait, then definitely you can get a job in any Middle East countries, and the payment is you will not believe, that's an awesome payment with a good number of working hours. If you take any Middle East country, the working hours are 48 hours per week, that is fixed, and after 3 years of your residency you will be paid around 4 to 5 lakhs minimum. 4 to 5 lakhs per month. Any Middle East country, you will be paid that much amount of money. So that is second opportunity. So one is going abroad, second is going Middle East. Third one is, sir, I want to settle down in this country only and want to do super specialization. Now again, here the options will open up for you. There are, like, you can enter into ICU and critical care, where most of the anesthetists will be entering, because of late, I have seen this trend where general medicine guys, they don't want to take up this ICU. They want to, they take up endocrinology, they take up endocrinology or medical gastro or something like that, but majority of the anesthetists, they will be handling the ICU part. So this, you have this DM of ICU critical care, DM of organ transplant, because of late we are having so many number of liver transplant, kidney transplant cases are happening in our country. So definitely we have this organ transplant. Pediatric anesthesia is one specialty, neuro anesthesia and cardiac anesthesia. These 5 areas are there which you can do the subspecialization. And believe me, if you are doing this subspecialization and you want to go to a tier 3 city and you say, sir, I want to do my general practice, okay, you can do it. But if you are doing these kind of branches, then definitely you will be settling in a tier 1 city with a good payment only. And corporate people, not in government institutions or medical colleges, but corporate people, they are fancy behind this degrees, super specialization degrees. Suppose if you say I am a liver transplant anesthetist, then definitely you will be taken up for liver transplant, because they want to open up, because doing a liver transplant, it will generate a lot of revenue for the hospital itself, right? So corporate people, they want the persons who have these additional degrees. Suppose if after 13 years, if you ask me, sir, what is the super specialization you have done, I say I did nothing except for 1 year of small fellowship in critical care. I did nothing about pediatric anesthesia, but my practice is entirely of pediatric anesthesia, because when I passed out, there was nothing like this branch pediatric anesthesia. Now we are having this DM super pediatric anesthesia. Maybe after 5-10 years, if you are a owner of the corporate hospital, whom will you employ? If a person without a degree qualification, or a person who is trained 3 more years extra with a degree or with more expertise in pediatric anesthesia. So obviously you will be taking the pediatric anesthesia. So corporate, there is a lot of scope for pediatric, cardiac, neuro, organ transplant, ICU. In corporate sector, there is a lot of scope. But when it comes to government hospital, obviously, as I said, the hierarchy runs. We are in the department. Suppose if I am the professor, you can't come and say, sir, I did pediatric anesthesia, I will sit in your chair. No, you can't say that like that. So when it comes to corporate, you will be paid well, basing on your degrees, and you have plenty of job opportunities. So for me, if you take up anesthesia, a student should plan in these 3 ways. Either he should be settling down, thinking of going abroad, doing super specialization, or going to Middle East countries. So these are 3 other options apart from your routine practice.
So how do you see it will affect the anesthesia as a branch?
Yes. Artificial intelligence, it has, everywhere it is getting. Even in anesthesia also, we have the, opportunity for artificial intelligence. I read it very recently. In our country, we doesn't have it, but there are, I read it, people are doing in some other countries like USA, they are doing research on, because, anesthesia is one branch where we don't know exactly where these anesthetics are acting on your brain and what is happening at the molecular level. Till now we don't know it. And there is a lot of scope for research area in this anesthesia. Unfortunately, research is one area in anesthesia. Maybe it might not pay you well. Because research requires funding from various other sources. In our country, research has got a limited scope, but when it came to artificial intelligence, yes, obviously things are opening up in a very different fashion. And as I said you, I read it, even we have got robots for intubation. We have got so many newer technologies that are coming into anesthesia. Maybe down the lane in 5 to 10 years, the first one will be affected will be the surgeons. After the surgery is improving, then automatically the anesthesia branch will start getting exploded by this artificial intelligence and the way people are looking at it. Obviously, artificial intelligence, once it comes into the picture, then obviously, definitely there will be an explosion. And, as I said, people are doing research on the anesthesia effects on space, anesthesia effect on the high pressure zones, high altitude regions, anesthesia effects on, so many, this branch is spreading out like anything. So artificial intelligence might create wonders in this specialty also. So right now,
Yes, sir.
in our country, yes, there is a lacuna is there, but I am expecting down the lane in 5 years. I don't think 5 years also that much time will be there, but in 5 years, definitely this artificial intelligence will come and surge into this department also.
Yes, sir. So, do you think that it will modify the work done by anesthesiologists somewhere? Any technological advancement?
Maybe in monitoring of the patients in ICU. Obviously, we have this cloud ICUs right now in our country. Like, not in our, yeah, it's there in our country. I have seen some of the ads because of this COVID, this cloud ICUs where people are monitored from a distant remote place and people are giving advices. But when it comes to the core specialty of diagnosing and doing a procedure on the patient, it might take some time. But yes, monitoring aspect, getting new devices to monitor the body systems of your body. Like, when I passed, what I strongly believe is this monitoring is improving. The monitoring is one area which artificial intelligence or the technology might be. This is one area which it will come and it will come into it. But coming to this airway management or handling of handling of emergencies also, there will be a smooth flow of the system. Like, it will not be in a haphazard system where, if you are training also, you will be trained as per the, as per the evidence-based medicine, rather than your whims and fantasies. This should be done. No, this should not be done. So the training part will be taken care, the monitoring part will be taken care. But the core procedures, it's not like radiology where you can make a diagnosis. So anesthesia is one area. It will help you. Maybe it might help you in giving a good effective block, because I have seen one area when video where when you are doing an ultrasound. When I was passed out, we never used to do ultrasound, but now I can do ultrasound and give a block in the area. I can do the fast scanning of it. At the time we were like, I used to read about it. I can do ultrasound, but now I can see if I want to identify a pneumothorax, I will do an ultrasound. So in that way, I can do it. Suppose if I am not trained, yes, it might help me in ICUs, in monitoring in the operation theaters, identifying the key factors, so that whether, right now, with my experience, I am telling, okay, this patient might land up in problem in intraoperative or postoperative period. But with the help of artificial intelligence, might be it will give me a predictive model in the pre-operative period only, and it will decide, okay, senior anesthetist has to come for this patient, even though it's looking a small surgery. It might tell me, okay, this person, because the predictive model what they have created, it might tell you that, okay, this might give a problem for it during this or after, so a senior anesthetist should be there. So it might give you this. But coming to the procedure wise, core technique wise, it might take a lot of time, I think so.
Yes, that's okay. And sir, you have described all points. Can you give the final message to someone taking anesthesia this year? He should prepare something in this vacation time or something like beforehand.
Yeah, final verdict. I personally feel it's not in the branch. Whatever the branch you take it, you put your heart in it. You start working for that branch and see the magic what branch will give it back to you. Many people ask me, sir, will it satisfy my financial needs? Any branch you take. I know people who are not even medical graduates and having a rampant practice. It's not about the branch actually. It's about how you are looking at the branch. So don't be in a notion that this branch is good, this branch is bad. For me, all branches are equal. The branches existed before you take up the PG. Even after you leave, the branches will start existing. It's about your status, perception of your whether you can take up this branch or not, and how much effort you are putting. Because when I see the resident before joining residency, they say, "Sir, I will join, I will do night duties, I will learn everything." But after 2 months, they say, "Sir, this month I am having problems, sir. I can't do night duties, sir. Please exempt me from night duty." No, if you are like this, whatever the specialty you will take, it will not help you much, right? So you put your heart, you start dedicating to your branch. If you know your core potentials, if you are, if you know your core potentials, that I can do this, I want this, if you put up your energy, then the branch will start giving you. So those who want to take this branch is a branch which has got diverse opportunities. Because I myself, you know, I'm a very small person in the department. I myself have experimented so many things in these 13 years. As I said you in the beginning, so many specialties I touched. And even I started working with some of the companies where I used to work with this data collection and all these things. So and some startup companies, I used to work with them. So many things which as a specialty that has helped me to stand right now here at this moment. Even, you know, anesthetist, what I noticed, wherever in the hospitals where the anesthetist is the administrator, I have seen the hospitals have doing very good. And I myself have, you know, during COVID time, we started in the government set up a 100-bedded hospital, and we efficiently managed the system, right? So this branch can give you anything, any branch, you know, not only anesthesia per branch, but provided how much effort you are able to put it, and what are your core limitations, core strengths and core limitations. If you know this, choose this branch, choose your branch wisely. And suppose you are in a situation where you can't take the decision, but forcefully anesthesia is, you know, you get only this option, you have given already 2 attempts, now that you are not able to take the 3rd attempt, when you are getting this branch, accept this branch wholeheartedly. The problem really comes, they say, you know, they start nagging in the department. They say, "Sir, I don't like anesthesia. Wish I was a surgeon. Wish I was a general physician. Wish I have taken dermatology where there were night duties." So, you know, if if you have got this branch, if you are planning to take this branch, yes, obviously identify your core strengths and take it. If someone is pushing the branch on you, like our system is having, so take this branch, accept it wholeheartedly. And in this period, in the vacation period, what you can do is you can identify this inner strength where you will, you know, you only try to think yourself, "Sir, can I do night duties? Can I extend my hours?" So many students, when they call me, I tell them, you imagine life as a circle. In this circle, give 25 marks. There are 4 quadrants of the circle. One is social life, personal life, financial life, and the professional life. These 4 quadrants, you have to fill up these 4 quadrants. But unfortunately, you cannot fill up with 25, 25. 25, 25, 25 is a idealistic situation, which you can't give it. Any specialty, if you give 1 quadrant more, you should be compromising on the 2nd quadrant. So how many, at what areas you can give more, at what areas you can't give more. If you can identify this circle, the life cycle, then obviously you can take a good decision and you can choose this branch. And once you are choosing this branch, obviously you can do the wonders. You start putting the heart and it will give it back to you.
Thank you so much, sir, for sharing your knowledge and wisdom towards aspiring anesthesiologists.
Yeah,
it will be very much helpful to the community.
This is one I really appreciate you, because you have taken a lot of pain to collect all the questions from the students' perspective, and you compile the questions in a such a fashion that that covers the entire spectrum. Maybe some 1 or 2 questions we might have missed it, but whatever you ask these questions, every year students call me before taking up the branch. They ask me this one, so I tell the students the same way. Depending on your personality, whether you want to take it or not. So this is what majority of the students, what the questions that were running in their brain might be. You might have compiled all these things and you put it.
Yes, sir. That was our only motto, that whatever the general queries are in students' mind before taking a branch, we should address it and answer them. from the subject experts.
Yeah, yeah.
So
Yeah,
thank
that's
you,
a
sir.
nice thing. Yeah. Okay. Wishing all the best for you and for the students. Wonderful job, Doctor. Please keep this one. This is awesome, because I wish we had someone who can tell. When I was taking my residency, we did some as we are also doing the same thing. Like, few years back, no one was there to tell what is right, what is. But at the end of the day, all are right, provided you have to make the things right, actually. Okay, so you take the specialty, and this is, if you are helping a person in a confused state, I really appreciate this one, because I can understand how much stress that a person goes through if he is having the
Yes.
option. Like, and that too, when you are taking up a specialty which you don't know anything, actually, like anesthesia, like
Yes.
specialty, if you don't know anything and you are coming, that might actually, if this should help, actually. So if they have anything more, we can just add on further.
Yes.